Hey friends, so here I am with another video, Transient Ischemic Attack. Now transient ischemic attack is also called as mini stroke. So as you see here the picture, the blood vessel in brain is occluded by a temporary clot. So there is temporary reduction in blood flow leading to a temporary neurological deficit, and the symptoms last less than 24 symptoms usually last less than 1 hour and resolves within 24 hours. So that's what we say in the next slide. Now, TI is a very common case nowadays, so just to know the causes for it. Modifiable risk factors, and we have unmodifiable risk factors. So, modifiable risk factors are alcoholism, cigarette smoking, dyslipidemia, hypertension, diabetes, obesity, high risk diet, lack of physical activity, and heart diseases like myocardial infarction, infective endocarditis, vasculitis, drugs like cocaine and amphetamine. Then there is unmodifiable risk factors like prior stroke, family history of stroke, old age, and male gender. Now the clinical features is it's divided into an anterior circulation TIA and a posterior circulation TIA. Anterior circulation means that supplies the anterior part of the brain, and posterior circulation means posterior part of the brain, and these both communicate with anastomosis. So anterior circulation TIA, the features are amaurosis fugax, aphasia, which is the absence of speech, hemiparesis, where there is weakness on one half of the body, and hemisensory loss, where there is loss of sensations on one half of body, hemianopic visual loss, where there is loss of vision on the same side of both eyes. Posterior circulation TIA is diplopia, where you see one image is two, vertigo, vomiting, dysarthria, where there is improper articulation of speech, then ataxia, loss of consciousness, and transient global amnesia. So these are the features of anterior circulation and posterior circulation TIA. Now, how do you investigate a transient ischemic attack? As we stated earlier, CT is usually the imaging modality of choice because it's widely available and it's faster and it's cheap. But in CT the infarct appears as a hypo-intense area and it's not visible after 48 it's only visible after 48 hours and not before 48 hours. MRI is more sensitive in picking up early infarction, can rule out any intracranial pathology, and even CT head can rule out if there is any hemorrhage, neoplasm, abscess. Now another investigation to be done is carotid and vertebral artery doppler. So that will rule out any stenosis. MR angiography to know the exact site of block. ECG and echo to rule out any heart disease like MI and infective endocarditis. Holter test for ruling out transient arrhythmia and other routine tests. How do you treat this condition is that you have to give them antiplatelet agents like aspirin. So aspirin is usually given in combination with dipyridamole. Aspirin 75 mg plus dipyridamole 200 mg is a very effective treatment when given twice daily. Anticoagulants are given in cases of embolic transient ischemic attack, which is triggered by atrial fibrillation. You can give heparin or warfarin. And if internal carotid artery stenosis is more than 70%, you go for an internal carotid endarterectomy. Now another alternative procedure is percutaneous transluminal angioplasty, which means with the help of a flexible plastic tube you will actually open up clogged or blocked arteries. Okay, and how do you treat the remaining is you look for what are the underlying causes and treat them accordingly, like diabetes, dyslipidemia, and all that. And if the person is taking alcohol or smoking, ask them to stop it. So don't forget of the two procedures, and that aspirin 75 mg is given with dipyridamole 200 mg, and that internal carotid endarterectomy can be done as an alternative procedure, percutaneous transluminal angioplasty. So that's it. Thank you, and do like, share, and subscribe, and hit the bell button for more videos.